The name Charles Cullen sends chills down the spines of those familiar with his crimes. This seemingly ordinary nurse harbored a dark secret. For over 15 years, Cullen moved from hospital to hospital. He left a trail of death in his wake. His victims, patients under his care. Cullen admitted to killing at least 29 individuals. However, the true number is suspected to be much higher. Cullen was an enigma. He was sworn to protect life, yet he chose to extinguish it. Driven by a twisted sense of compassion, he believed he was relieving patients' suffering. His actions were a gross violation of trust. Cullen's case stands as a chilling reminder of the vulnerability of hospital patients. It exposes the potential for evil to lurk beneath a veneer of respectability. Cullen's killing spree began in 1988. He was working as a nurse in New Jersey. Over the years, his methods evolved. One constant remained. Cullen used his access to medications to commit his crimes. He became adept at blending into the background. He was a silent predator, preying on the most vulnerable. Charles Cullen used his knowledge of medicine to kill. He chose drugs that would be deadly but difficult to detect. He often opted for intravenous medications. These could be administered quickly and discreetly. Cullen's drug of choice was often digoxin. Digoxin is a heart medication. Even a small overdose can be fatal. He also used insulin and lidocaine. Cullen favored these drugs for a reason. They left minimal traces in the body. This made it difficult to determine if a death was natural or intentional. Cullen understood the intricacies of hospital procedures. He exploited gaps in the system. He often administered the fatal doses when other staff were not present. This made it easier for him to avoid detection. Cullen's methods were calculated and cold-blooded. He preyed on patients who were already weak and vulnerable. Many were elderly or critically ill. They were easy targets. His crimes went unnoticed for years. He moved from hospital to hospital, leaving a trail of death in his wake. When Charles Cullen was finally apprehended in 2003, authorities faced a challenge. They needed to build a strong case against him. They also wanted to identify all of his victims. This led them to offer Cullen a deal. In exchange for his cooperation, they would not seek the death penalty. Cullen agreed to the plea bargain. He began to provide details about his crimes. He confessed to killing dozens of patients. He helped investigators uncover previously unknown victims. This information was crucial. It provided closure for families who had long suspected foul play, but had no proof. Cullen's cooperation came with conditions. He wanted to donate a kidney. Specifically, he wanted to donate it to the relative of a former girlfriend. This request sparked controversy. Some argued that a convicted killer did not deserve the privilege of organ donation. Others believed that his cooperation warranted some leniency. The issue of Charles Cullen's kidney donation became a legal and ethical quagmire. On one hand, he was responsible for the deaths of numerous individuals. On the other hand, he was cooperating with authorities and potentially saving a life through his donation. The judge overseeing the case faced a difficult decision. He ultimately ruled that Cullen could donate his kidney. However, he imposed conditions. The recipient's insurance had to cover all costs associated with the transplant. The surgery could not delay Cullen's sentencing. Cullen's sentencing was a highly publicized event. Victims' families had the opportunity to confront him. They shared their pain and anger. They spoke of the devastating impact of his crimes. The judge sentenced Cullen to 11 consecutive life terms without the possibility of parole. He will spend the rest of his days behind bars. His case remains one of the most chilling examples of medical murder in history.